Welcome back, everybody. We're just going to continue with our material. Again, getting really close. We should have one more video after this for this first unit. So not bad. Let's go to where we were. All right. Covered all this. All right. So the last thing we talked about was regarding to the regional stuff. We mentioned axial versus appendicular. We mentioned that axial is more like the axis, so think of like the trunk of a tree, whereas appendicular is going to be more associated with um, the limbs. As far as the limbs are concerned, that's literally your arms, your legs, stuff like that, right? All right, let's move on to some more anatomical terminology. So as far as orientation and directional. First off, we have superior versus inferior. Simply put, we don't worry too much about cranial or caudal. I don't use those names too often, but simply put, superior is indicating towards the head or above. So the example we have here is the head is superior to the abdomen. That's easy. Inferior is going to be below or anywhere away from the head. So the example they give is the navel, which is the belly button region, if you didn't know, is inferior to the chin. Okay, that makes sense too. Next, we have anterior posterior. Anterior posterior are important, but we also need to make sure that we know ventral and dorsal. Doing my best to underline with a trackpad today because I'm not on my normal device. But anterior, otherwise known as ventral, is indicating towards the front of the body or in front of. So in that case, the example they give us, the breastbone, known as the sternum, is anterior to the spine because it's in front of the spine. That makes sense. Posterior, when I think of posterior or its other name, dorsal, I always think of dolphins. So I think of dorsal fins. That's the fin that pops up out of the water when a dolphin, a shark, an orca, whatever, is getting pretty close to the surface. We don't have fins, but we do have a backside. That's our dorsal side. So it's pertaining to the back of the body or behind. So dorsal, the context here, as far as what we see, we have the heart is posterior to the breastbone. So the heart would be behind the breastbone. That's what we expect, or the sternum. Next, medial and lateral. When I hear the word medial, I think of middle. When I hear the word lateral, I think of the lateral outsides, right? So with regards to medial, literally you see the middle of the body. So the example they give is that the heart, even though it's not in the dead center of the chest, the heart is medial to the arms. So it's more towards the middle compared to the arms. In that complex or in that idea of with regards to medial, what I try to think of is I think of the face. The face is a very symmetrical structure. So when I think of the face, there are some medial structures such as the nose and the mouth, right in the middle. That works for me. Lateral, you could think of football if you're a fan of football or you play football, so you might be familiar with this as far as a lateral pass, moving the ball towards the sidelines. You're not moving it forward. Lateral also indicates away, so away from the middle. So the example they say there is the arms are lateral to the chest, which that makes sense. The arms are away from the middle. In that face analogy I was giving you, the part of the face that I would consider to be more lateral, your ears. So your ears are lateral compared to your nose and mouth. Proximal and distal. These can be tricky. Honestly, for our first unit, the big thing I want you to understand is that proximal, I think of proximity, so it's all about how close it is. Whereas distal, I think of distant. So with distal, it's more about how far it is. So want to clarify that, want to make sure we're good as far as some of those basic terms. It is oriented around point of origin, so where it begins. So the example you see here is that the elbow is proximal to the wrist, whereas the knee is distal to the thigh. Again, when we do skeletal system, I'll explain more about proximal distal because those terms are pretty influential to skeletal system. But for now, I'm fine with just understanding it's close or far. Proximal means close, distal means far. Next, a couple more orientation terms. Superficial and deep, we do use. Ipsilateral, contralateral, we don't use as much. That's just how it is. Superficial is going to be towards or at the body surface. So if you ever hear somebody using the word you're being so superficial as an insult, that means you're just being so surface level. Typically, you're also being a pretty shallow individual. Not you're not you're not more complex as far as your personality and other things like that. So the example, they say the skin is superficial to the muscles. That makes sense. The skin is literally the most superficial organ we have. Now, deep is the opposite of superficial. Deep is indicating internal. So the example they give, the lungs are deep to the skin. I always think when I hear deep, I think of the core, like the Earth's core. You're digging down. That's kind of what happens with the organs, right? They're internal, they're layered, and all that stuff. Now, ipsi and contra, as I mentioned, we typically don't say those too much in our course, but it's worth talking since we're here. I like to mention that the course sometimes feels like we're learning a new language because a lot of Latin and a lot of Greek. So ipsi is indicative to the same or similar, whereas contra, you may have heard of contradictory, so you've probably heard this one before, but contra is more about the opposite. So ipsilateral is indicating the same side. The example they say is right hand, right foot, whereas contralateral is going to be opposite sides, right hand, left foot. Okay, next. There's a lot here. There's a lot going on here. We don't need to know all of them. The ones that are bolded, we do need to know. And there's one that's not bolded that I'm going to try to underline to make sure that we pay attention to that one. So, all these regional terms we've learned before in kindergarten, right? We learned the head, the neck, the chest, the arms, the legs. But these are the more anatomically correct names for these regions. So, we're applying a little bit of science here. So first and foremost, at the very top, we have cephalic. Cephalic is the head region. As far as cephalic is concerned, that's going to be frontal, forehead, orbital, eyes, nasal, oral, etc. Those non-bolded ones, we don't need to worry about those just yet. The one that we need to know right now is just cephalic, but those other ones we're going to learn eventually. From the cephalic region or the head, we move on down to the cervical region, the neck. The cervical region connects the two areas together, right? Moving on down, we're now in the chest, which is that orange colored region. That's going to be the thoracic region. So your chest. You move on down. Most of us already know this one, abdominal. We got that one down. So you can kind of summarize it as your belly if you'd like. I try to avoid saying your stomach region because the stomach is its own organ, but it's around that area. So you could kind of work with that. Now, the one that I'm going to try to underline here is umbilical. Actually, I'm going to erase this because it's kind of blocking the other one. So maybe I can do something like this. The best I can with the trackpad. There you go. That's not bad. Umbilical. Umbilical is a region found in the abdominal. The umbilical is otherwise known as your belly button. It's where the umbilical cord would fuse when you're in development from the embryonic to fetal stages. It's all stuff we're going to learn in reproductive system. Under the umbilical, we have the pelvic. Pelvic is your hips. So your pelvis is literally what the hip bone is called. So that's easy. Then we have the pubic region, also known as the genitals. Genitals is not a sex-linked word. Genitals is applicable to men and women. So you're going to have the genitals or the pubic region. Again, when we learn reproductive, we'll see a lot of those words sound similar as far as word origin. On the right-hand side of the picture, the arms, super easy. They're known as your limbs, upper limbs. No big deal. Moving on down, you may recognize right above the hand the carpals, which are the wrist. Carpal tunnel, that should sound familiar to some of you. The hand is known as manus. For any Spanish speakers who are watching or who know Spanish as well, manus should sound familiar because hand is mano in Spanish. So a lot of this Latin, like I mentioned, starts to click in pretty easily. The parts of the hand we don't need to worry about, like the thumb has its own name and all that stuff. If we have upper limbs, then guess what? We got lower limbs too. The lower limbs are the legs. That's easy. And then finally, the feet are known as your pedals. I always think of a car where you have a gas pedal or a bike where you put your feet on the pedals. You know, it's the same idea. Your pedals are the base of your body, otherwise known as your feet. So go ahead and erase that real quick. There we go. All right, moving on down. The backside, a lot of this we already discussed as far as the bolded terms. The only term that we haven't yet seen is right here, back, aka dorsal. So what do we call the back? The dorsal side. That's it. That's easy. That's easy. No problems there, right? So we talked about that in our stuff earlier in this video, in fact. Okay, last but not least, we have a little bit more covering in this video. We have what's called body planes. This is not planes that fly around. These are 3D planes. And the purpose of these 3D planes is to help with imaging. It's what you see here in the bottom. This imaging would be like MRIs and CAT scans and PET scans. Those imaging tools produce images that are 2D. And because we're 3D creatures, you need to be able to really identify where are you trying to look for? What are you trying to find? Because otherwise, if you don't do a scan correctly, you can miss what you're trying to find, and that could be life or death for a patient. So there are 3 primary planes that I want us to worry about. There's a 4th one. I'll talk about it, but we don't need to worry too much about it. We have the frontal plane, also known as the coronal plane. I typically just call it frontal. The frontal plane is going to be a vertical plane that divides the body into an anterior and a posterior side, so front and back. The median plane is going to be another vertical plane, but it goes right down the middle, and it separates your left and your right. Finally, we have what's called the transverse plane. This is a horizontal plane, and it divides the body into a superior and inferior, so a top half and a bottom half. The way I like to think of this with regards to the planes is I think of, and it sounds kind of weird, but I think of like Tarantino films, where you'll have a buzzsaw, or you'll have these crazy moments like super gory, and you'll see a character split in different weird ways. I don't know. To me, it makes the most logical sense if you think of it that way, right? In a super stylized version. So, for instance, with the frontal plane, if a buzzsaw were to cut me from this left side all the way to the right side, my front half would be separated from my back side. With the median plane, a buzzsaw would be going right down the middle of my face. And this is the one that Tarantino loves doing, where you'll get that shot of the character, and then suddenly you just see them split from left to right. That's the median plane. And then the transverse plane, this isn't as intense, but the transverse plane, I just think of the classic magician's act, where the magician will say, my assistant is in this box, and I'm going to saw them in half, and suddenly they're going to be split in 2. That split in 2, you have their top half and you have your bottom half. I had a student actually reference, if you watch Star Wars, Episode 1, when Darth Maul gets killed, he is split along the transverse plane. So, well, killed because he actually survives, but that's a whole other ordeal. So that's all the planes that I want us to worry about. There is one more, the oblique plane. The oblique plane cuts the body from a 45-degree angle. This could be helpful for a lot of different scanning and imaging tools as well, but honestly, we don't really talk about it too much, so we don't need to worry too much about that. All right? So we're literally almost there. We have a couple more slides left, one more video to go for this unit. But guys, thanks for tuning in. I'll see you guys on the next one. Enjoy yourselves.